Hello, I'm Chris White, a member of Long COVID Scotland, a group made up of people struggling with long COVID and wanting to make a difference, not only to our own lives, but the lives of other people living with long COVID. One of the ways we can do this is by getting involved in research. It's really important for patients to be involved in the research process, but I'll come back to that in a moment. I started 2020 with hopes and expectations of what a new year would offer. None of us could see what would actually happen and the impact it would have on all of our lives. Early in the year, we heard the first reports of a new virus. Soon after, we started seeing people admitted to hospital. We have all had to make adjustments since then. In September, I tested positive for the virus. To be honest, like many, I was fortunate and not too unwell. After 2 weeks off work, I expected life would return to normal. It didn't. Like thousands of people across the UK, I experienced, and almost 12 months on, continue to experience, symptoms that have a profound effect on my life. So what do we do as patients when we don't get better? We approach our doctor, explain our symptoms, and hope for a solution, a treatment that will help us get our life back on course. But that is not always what happens after ill health. And for many of us, that's not what we're seeing post-COVID infection. Doctors and clinicians don't always have the answers. Long COVID is a new condition. It may share similarities with other post-viral illnesses or health conditions. But why is long COVID having such an impact? We just don't know. And that's why we need research. Doctors, healthcare providers, professors, academics all hold a wealth of knowledge and experience of health conditions. However, they do not necessarily have the personal insights and experience of living with long COVID. In order to find answers, develop solutions, researchers need to understand what is going on. And that's why we need patients, people living with the consequences of long COVID, to be involved in research. As patients involved in the research process, we can put our personal experiences to good use, providing insight, knowledge, and understanding. It can be easy to see ourselves just as a patient. What can I offer? But patients, their family, their carers are an important part of the research puzzle. We provide a wealth of knowledge and information that can help the research community. Working together, we can help the medical community understand long COVID, how it affects our bodies. That can lead to improvements in the quality of care available, or develop treatments and rehabilitation programs that can change lives. Public involvement can be fluid and flexible, and can happen in many different ways to suit the individual, always voluntary and without the pressure to be involved. In Long COVID Scotland, we have a research subgroup made up of volunteers willing to share their experiences and time. That has included completing questionnaires, taking part in focus groups, actively involved in the design or research process, or commenting on proposals, right through to being co-applicants or advisory group members of funded research projects to help develop that understanding. Each one of us, as patients, has a unique insight into long COVID. Working together as a valued part of the research community, we can and will benefit lives.